Hello, I'm Assistant Town Manager Andy Clyburn, and I'm joined by Deputy Chief Jennifer Ellis. We're going to give an update on the opioid community engagement process. This update from the Opioid Settlement Funds Working Group is about our community engagement process related to the opioid settlement funds. We will be sharing what steps we took, what we heard from our community, and where we are now. We won't yet be sharing a detailed action plan for how the funds will be dispersed. That will be part of the next phase of the project, which we will start this fall. We will be issuing a notice of funds available and providing an application process to disperse the funds based on the guidance from our community engagement process being discussed in this presentation. We acknowledge that a tension exists. There's a sense of urgency of wanting to take action and also wanting to take our time and move forward with intention. This slide shows all of those who participated in the Opioid Settlement Funds Working Group. Quite a large group, including our Superintendent, Sarah Hearn, Hyannis Fire Chief, Peter Burke, Assistant Building Commissioner, Jeff Carter, Barnstable Police Chief, Gene Chalice, myself, Deputy Chief Ellis, our Building Commissioner, Brian Florence, our Director of Community Services, Chris Ganella, our Finance Director, Mark Milne, and Deputy Finance Director, Gareth Markwell, the Chairman of our Human Services Committee, Cheryl Powell, our Director of Communications, Lynn Poyant, and the Executive Director of Social and Emotional Learning and Student Services at Barnstable Public Schools, Mary Beth Taylor. I do want to note those listed here in purple were the members of our design team, and they're the ones that really carried the heavy lift through this initial phase of our project. Those are Chief Burke, Jeff Carter, Deputy Chief Ellis, Cheryl Powell, Lynn Poyant, and Mary Beth Taylor. So huge thanks to all of them. And we wanted to make a special thank you to our facilitator, Sky. She was fantastic, paramount to really driving us through all of this community outreach. This slide shows the anticipated funding over the next 15 years. As you can see, we anticipate getting well over $3 million, so it is a significant amount of funds. And today we have received nearly $900,000. So again, back to that tension. We know we have a lot of money and we want to move and get some funding out there in the community, but we are talking about a sizable amount of money and $3.2 million. So we want to make sure we do that with intention. As far as what the funds can be used for, this was developed using input from public health experts, municipal leaders, and families affected by the crisis. We can spend the funds on support and promote treatment for persons with opioid use disorder, or OUD, support and promote programs and strategies to support people in treatment and recovery, provide connections to care for people who have or at risk of developing OUD, support efforts to prevent overdose deaths or other opioid-related harms, support diversion and deflection programs, and strategies for criminal justice-involved persons with OUD, support pregnant or parenting women with OUD and their families, and support efforts to prevent misuse of opioids. Our timeline, we started in the spring of 2023. I met several times as a large working group and discussed various approaches. In the fall of 23, we went through a procurement process and engaged our great facilitator, Sky, and began the planning. In January of this year, we held a large community conversation, inviting input from a diverse group of stakeholders. And then in the spring, we held 4 focus groups. And then this summer, we distilled that information gathered, share that output back with the folks who had been involved, and ask for additional feedback and insights.
So a sample of the materials that we posted onto social media and passed around all of them were translated into Portuguese and Spanish so that we could be very inclusive as far as who we were inviting from the community. We really wanted to hear from everyone. At the January 30th event, we had almost 90 people attend, including a number of town councilors. So thank you for attending and sharing a voice into this important issue. The focus groups that we discussed, which occurred in April, included 4 different groups. They included community groups and service providers, Barnstable Public Schools staff and administration, loved ones of folks who have struggled with opioid substance use disorder, and individuals in recovery from opioid substance use disorder. Then on July 16th, we held our final community session. It was a reflecting back session to hear again from our community members about the opioid epidemic in Barnstable, and for us to close the loop on our conversations and input from the community so that we could move forward with intention and with a focus on where we need to spend these funds. What we experienced and learned, first of all, would really like to thank everyone who came out and participated in this process, and I again thank the town councilors that were able to join us throughout this process. There are many deeply committed individuals in our community who care immensely about this issue and want to see things improve. We are grateful for their care and hard work. There was value in holding the community meetings we had. It is worth it to lean into this process and take the time to bring people together to discuss the impact of this epidemic and the challenges and opportunities that exist. Calendars are busy and it can be difficult to get folks out to meetings and public forums. That being said, it always helps to provide food, which we did. I do want to thank Lynn Poyant for helping to coordinate all of that. What we heard, I'm not going to go over all of the slides, but I will touch on a few of the slides that spoke to me. There's definitely a greater need for mental health support and increased awareness around this disease. We need more education and prevention, and we need it early and often. We need more sober housing and more local access to sober housing. We need grief and therapy support for families and friends. We need more harm reduction, and that includes knowledge, access, and reducing stigma of this disease. And increase awareness of supportive meetings. We need transportation to help individuals attend all of these different points of access. Families need support, and this includes grandparents raising grandchildren. And we need more structured support for long-term care and sober living. So really what we heard is that people from all layers of this disease need support, and that includes families, individuals, and friends. The grant covers 4 specific areas. That includes prevention, harm reduction, treatment, and recovery. The opioid epidemic is an extremely complex issue. We have decided that we will give attention and allocate funds in each of these areas and not just focus in one area. They are all important and interdependent. Thank you.